Hi there, my name is Catharine Woods and I'm delighted to be speaking to you today from the University of Limerick on physical activity policy from research to practice. Give me a second to share my screen with you and we'll get started. Okay. By way of an introduction, I'm Director of the Physical Activity for Health Research Centre here in the University of Limerick, and I'd like to acknowledge the principal investigators, research staff and postgraduates who helped PAF achieve its mission, which is to be an interdisciplinary hub of research excellence with real-world impact in policy and in practice. We have three pillars: research excellence, capacity building and internationalisation, five thematic areas: measurement, biomedicine, policy intervention and development, exercise as medicine and more, and active and sustainable mobility. And we are one of four research centres of excellence in the Health Research Institute in the university. And in 2024, we received the President's Research Excellence and Innovation Award for Outstanding Research Collaboration. Today, I'm going to speak to you about physical activity policy, the Irish Physical Activity Research Collaboration, and the development of the Physical Activity Environment Policy Index. To start, there has been an exponential growth in policies targeting the upstream determinants of health behaviours to reduce the burden of lifestyle-related diseases like physical inactivity. Examples include the WHO's Global Action Plan on Physical Activity, which has set a target of a 15% relative reduction in the prevalence of population physical inactivity by 2030, and link the promotion of physical activity to the achievement of the university's Sustainable Development Goals. Within GAPA, a systems-based approach is recommended. Within GAPA, a systems-based approach is, Within GAPA, a systems-based approach is recommended, one that tackles policy actions to create active societies, active systems, active environments, and active people. And it uses for this policy, which, as I mentioned, is an upstream solution. The role of policy is to change systems instead of individuals, and in doing so, create supportive, enabling contexts that either directly or indirectly influence physical activity. And what exactly is a policy? Well, it's a coordinated package of measures around a specific subject issued by governments or organisations, for example, as formal or informal, legislative or regulatory statements of intent or guidelines to action. And in theory, public policies are perceived to be an ideal tool for the promotion of healthy lifestyles, but in practice, this often fails to be the case. Policies can influence physical activity directly, for example, the provision of free swimming classes to target groups, and indirectly, e.g. legal traffic speed limits for residential environments, increasing perceived safety for these environments for walking and cycling, which is highly correlated to higher levels of active commuting. But we need to be careful not to confuse policies with other forms of intervention. Policy interventions are not to be confused with other types of programs or environmental interventions. Policies and policy interventions provide the framework in which programs or environmental changes are tendered, developed, financed, and implemented. And our knowledge about the status, the implementation, and the effectiveness of policies that can promote physical activity in different countries is still very limited. And there is consequently no clear guidance on which policies governments should preferably use in different settings or under various preconditions. So, since GAPA has been published, there has been documented good progress at country level regarding the introduction of national policies for physical activity, but minimal progress on addressing population levels of inactivity. In part, I believe this is due to a lack of upstream policy progress in effective domains, and in part due to a lack of effective infrastructure support for policy implementation, as we are unlikely to reach the WHO target if the system or the environment remains unchanged despite our best downstream efforts or programmatic efforts. So unless we build that bridge across the river, doesn't matter how good our programs are downstream, people will still keep falling in. We need to prevent that through enabling contexts that help people to remain physically active. So moving from there into the Irish Physical Activity Research Collaboration. So the challenge, or in seeking to address GAPA's challenge of a systems approach, Ireland undertook an audit of existing national policies that influenced physical activity. You can see examples of these policies here on your screen. In actual fact, we had over 18 policies. These were all examples of the effort of multiple sectors. And while their agendas in education or health or planning or sport may be different, they all had one thing in common, a common goal of reaching their aims, their targets, their objectives using something called physical activity as a main or as a smaller part within their policies. But the challenge still remained. The challenge was, how do we go from 18 plus policies that work in isolation and consequently have limited impact because of this, to achieving coordinated impact as the policies aligned with each other and understood how they could help each other. But actually, where we want to get in Ireland is to collective impact, where the different sectors collaborate so that they combine their policy actions to have collective impact. And how we do this was we have a standalone overarching physical activity policy for Ireland. This is called Get Ireland Active, a National Physical Activity Plan, and it was jointly published by the Minister of Health and the Minister of Transport, Tourism and Sport. It has 8 action areas, including children, workplaces, community, whole of school programs, mapped to the domains, the effective domains identified in ISPA's best investments. And it has 60 policy actions with clearly identified lines of responsibility, partnership, and timelines. Here you can see Action Area 7, which is on research, monitoring, and evaluation. And this provided the mandate, numbers actions 52 through 54, provided the mandate to have policy that was informed by research and evidence, and led to the development of the Irish Physical Activity Research Collaboration. So the University of Limerick, in collaboration with the Department of Health, were successful in getting funding from the Health Research Board for an Applied Partnership Award to answer this question: how do we successfully implement effective physical activity interventions to reduce physical inactivity in the Irish population? And I-PARC therefore brought together lots of stakeholders to foster insight, intelligence and innovation to enable more people in Ireland be more active more often. And we wanted to build bridges across policy, practice and research to support solutions, share learnings and achieve impact. Because physical inactivity, although the problem requires global effort, in reality it is a local issue. It's local to a country, a region, a city, a town, a village. Consequently, it requires domestic advocacy, a web of organisations and individuals linked by a shared common concern to address a condition that affects or potentially affects a sizable portion of the country's population. Physical inactivity was that common concern, and we brought together policymakers, researchers and practitioners in this network, this web of organisations. But coming together is only part of the solution. You need to have a roadmap of what it is you're going to try and do. And for this, we used implementation science, and we adopted the National Implementation Research Network's formula for achieving socially significant change. Our socially significant change was increased population levels of physical activity. And according to this formula, we needed effective interventions that would be effectively implemented within an enabling context. And interestingly, the relationship between each of these concepts is multiplicative, in other words, exponential. So any one of these can have an impact, but when combined, and only when combined, we believe that socially significant change can happen. So I-PARC, in its first grant, the 2017 grant, it developed the evaluation toolkit for effective interventions. It developed the implementation toolkit for effective implementation. And the one I'm going to talk to you now about a little bit more is our systems approach toolkit. And you can read more in our publication here, but it used the Global Action Plan for Physical Activity to really look at what we were doing well in each of these quadrants, what we needed to be doing better, and really to yield an action plan for how we could improve the implementation of our public sector policies to generate this enabling context. And that brings me to the Physical Activity Environment Policy Index. So in physical activity, there are currently many different tools and initiatives that exist to monitor and audit physical activity policy, such as WHO's policy audit tool and the European Union's physical activity country fact sheets. And these focus on the question of which policies have been adopted in a particular country. However, there is also a need to really look at the status of their implementation, as existence of policies alone is insufficient, and whether these policies live up to international standards of best practice. And this is why we developed the PA-EPI. So the PA-EPI is a tool for the evaluation and benchmarking of the implementation of public policies to promote physical activity and create a healthy physical activity environment. It can help policymakers to determine where their country is now in relation to the implementation of policies, what is possible to change. It provides pathways on how to reach goals to address critical implementation gaps, and it provides a mechanism for documenting progress. And this work was conducted as part of the Policy Evaluation Network. This was a consortium of 28 research centres across Europe. It ran for 4 years, and in this it developed a whole suite of activities and deliverables. But one was the development and pilot testing of the PA-EPI in Ireland. So the development of the PA-EPI involved 4 stages, one building on existing work. And here you have the Informus project, which developed the original Food Environment Policy Index, or Food-EPI for short, now currently implemented in 60 countries worldwide. The PA-EPI is a sibling tool of this Food-EPI. We also built on ISPA's 8 investments that worked, the different domains within which we know physical activity promotion can be effective. So we built on this. We added through scientific systematic literature reviews. We also reviewed relevant policy documents from international and supranational organizations, and we conducted an expert and policymaker review. But our systematic literature reviews looked at different settings. Let's take an example of the school setting. So when we went in to look at the school setting, first of all, it became apparent that we really needed to be clear on what policy interventions were and how they differed from programs or environments. Very often these terms are juxtaposed, but they are very different. So when it comes to policies, you need to know the domain you're talking about, in this instance, the schools, the level, is it local, national, state, the area you're talking about within the domain, and the actions. And in actual fact, as part of the systematic review we conducted in the schools setting, we found that although schools are an important setting, as the majority of children and adolescents spend a substantial amount of time in this setting and whole of school programs are recommended, there is a lack of studies focusing explicitly on the evidence for physical activity policies. And although we found evidence of policy impact on physical activity within the school setting across 9 different policy areas that included things like physical education, school-related physical activity, shared use agreements, surveillance and active travel, etc. What science is telling us, or what are the gaps in our knowledge when it comes to these areas? And within any one of these areas, we know that there are a number of actions that need to happen. So a policy action in physical education needs to include things like requiring a minimum amount of time, requiring adherence to a PE curriculum, requiring teaching by specialist trainers, requiring PE to be evaluated, requiring our measurements to reduce class sizes, and requiring adherence to standards of accessibility, inclusion, equity, and so on. This is what the systematic literature review showed us in relation to best practice. And we went on to conduct these reviews in sport, transport, and mass media. And the outcome of these reviews and synthesis of the evidence was that we developed the PA-EPI framework. The PA-EPI index here consists of 2 components, the policies themselves and the infrastructure support. 15 domains and 45 good practice indicators. The domains are the settings within which the policies are made, adhering to ISPA's 8 investments, and infrastructure support is the necessary infrastructure for the successful implementation of policies in these domains. There are 45 good practice indicators, and these map to each of the domains, and these are indicators of ideal practice in any one of these domains. The good practice statements look like this. This is too small for you to read, but there are 21 good practice statements in the policy domain, 24 in the infrastructure support domains. In the policy domains, an example, number 5 on this sheet, is in transport, TO1, and it says that regulations are in place that provide a variety of infrastructure support to support safe walking and cycling and/or wheeling, including measures to calm speed, reduce vehicle traffic, and enhance active mobility. So this is an example of one good practice statement under the domain of transport, which we would like to see evidence of implementation of policies within that show action in this area. And in the infrastructure support domain, an example under leadership would be, for example, that there is evidence of strong, visible political support at head of state or cabinet level for creating health-promoting policy environments to improve population levels of physical activity and reduce inactivity, and so on. So the framework is also aligned to a process. And this is the 8-step PA-EPI process. And the process, 8 steps, the first 4 are to do with evidence compilation. You then have gap identification and advocacy. And what you're looking at here is the first 4 steps involve analysing your national context, collecting relevant information on the extent of policy implementation, the existence of policies, and then extent of implementation of those policies, evidence grounding the policies and their actions, and importantly, validating this evidence with government officials, effectively co-creating with government officials an evidence document. We refer to this as the PA-EPI evidence document. You then form a physical activity environment policy index coalition, PA-EPI coalition, which is either an existing or a newly formed national coalition of non-government but informed stakeholders and researchers. Stakeholders could be individuals at the forefront of implementing the policy that you've identified, for example, in the evidence document, and researchers are your academics who are researching and studying this area. They will then rate the government extent of implementation in comparison to international best practice. These scores will be weighed and summed up, and then they will be a prioritization exercise where the PA-EPI Council meets, observed by your government officials, and recommendations. 5 recommendations are brought forward based on their importance in achieving change, but equally their feasibility. So at the end of the PA-EPI process, you have 3 outputs. You have an evidence document, which compiles the evidence of implementation. You have the PA-EPI Council's scoring of the status of implementation in your country in comparison, not to blue skies, but in comparison to existing concrete examples of the implementation of those policies elsewhere in the world. And from that, 5 recommendations from the policy domains, 5 from the infrastructure support domains on how your country can progress and address critical implementation gaps. And in the Policy Evaluation Network, we piloted this in Ireland. Some of the recommendations that went forward in Ireland was one around mass media or multi-sector coordinated campaigns, and to move away from single sector campaigns to sustained cross-governmental campaigns, multi-sectoral, multi-annual campaigns, to improve the connections between healthcare and the local community, and on the infrastructure support to update our national physical activity guidelines and to provide long-term funding for scaling up of effective physical activity programs. We have achieved 2 of these, and the other 2 are ongoing. So that brings me to the conclusion and the next steps. Well, we're currently about halfway through the impact study, which is a follow-on from the Physical Activity Environment Policy Index. And this is involving the evidence document compilation, the gap identification and advocacy in not 1, but 6 European countries. So Ireland will do its second PA-EPI, and the Netherlands, Poland, Romania, Lithuania and Germany will undertake PA-EPI for the first time. So that means, to summarize, we are now able to assess the extent of implementation of government policies and actions in 6 EU countries. We have created a policy index to assess the healthiness of the physical activity and policy environment. We can provide countries with concrete examples of international best practice, and we can create a mechanism where countries can document their progress. So for next steps for this area, what we need to be able to do is have clear consensus on physical activity policy terminology. 2, a clear understanding of the many policy tools and instruments that exist and their role in advancing the PA policy agenda. We need to identify countries at the forefront of creating a healthy physical activity environment policy index, and from this have a repository of best practice exemplars that are important, that are accessible and feasible, and a mechanism for countries to document progress. I would like to thank my collaborators for all of the work that we've been doing so far, and on behalf of the Impact Symposium, and to thank the funders, the ERA for Health, co-funded by the European Union. If you want to contact me, here's my email, and here's the Research Centre email address. Research, not that one. Oh no, sorry. Thank you very much.